You are listening to Golden Otter Divinations, where the metaphysical meets the mainstream with Autumn Seibel. Tune in 9 a.m. Pacific the first Friday of every month as Autumn helps you manifest your dreams by connecting to loved ones in spirit, empowering you to find both physical and spiritual healing. Are you ready to transform your life and connect to divine guidance through practical strategies? Golden Otter Divinations is the place to find engaging interviews with medical experts, practicing mediums, intuitives, healers, and many more. Now, here's your host, Autumn Seibel.
Hi everyone, I'm Autumn and you're listening to Golden Otter Divinations on Transformation Talk Radio. Stay with us for the next hour as we explore where the metaphysical meets the mainstream. Join us live each first Friday of the month at 9 a.m. Pacific, noon Eastern, when we have new, informative, and engaging interviews with medical experts, practicing mediums, intuitives, healers, and many more to help uplift, educate, and empower listeners like you to find physical and spiritual healing. So it's time to get physical, a metaphysical exploration of chiropractic care and energetic bodywork. What do a medium and a doctor of chiropractic medicine have in common, you ask? Besides being siblings, much more than one may think. Today, I'm interviewing Doctor August Manelick to discuss chiropractic care for a fun and flexible start to the new year. I hope you all had an amazing holiday and are ready to get funky on this new year. Today, I have with me Dr. August Manelick, who is a doctor of chiropractic medicine. He's a lifelong Alaskan, U.S. Army veteran, and family man who's excited to serve his Matanuska Susitna Valley community and rural Alaskans. As a trusted leader, Dr. Manelick is dedicated to patient care and passionate about the healing power of natural physical medicine. His education and training were achieved at the world's most esteemed chiropractic institution, Palmer College of Chiropractic Medicine, located in Davenport, Iowa. His initial bachelor's degree is in health and human sciences from Bond University in Queensland, Australia, and he has a second degree in kinesiology from the Pennsylvania State University, where he commissioned into the U.S. Army through the Reserve Officer Training Corps and served as the captain of both the Penn State men's rugby team and U.S. All-American rugby team. Got a spine down in the back. He's going to go fix it. Dr. August Manelick has worked and trained with various athletic, occupational, and therapeutic groups. His work experiences range from the Australian Olympic baseball team to the United States collegiate and national level rugby teams. Dr. Manelick shares the beauty of Alaska's magnificent outdoors with his wife, Sarah, and their 4 children. His devotions to nature and family can be seen outdoors as he is constantly adventuring into the wilderness and on the waters. Altitude Chiropractic, his chiropractic clinic, is a veteran-owned and operated chiropractic clinic. So with all that said, welcome to the show, Dr. Manelick.
Well, thank you so much for having me, Miss Medium.
We have a spine in the background of the recording, what is that called that we're looking at? Like it's just a replica of a human spine?
Yes, that is an anatomical replica of the human spine. That way I can give a visual demonstration to patients so they have like a hands-on understanding of where their malalignment, subluxation, or nerve pinch is.
So you were quite literally fixing spines as we were recording.
Yes, ma'am.
Never stops for you. So what I like to do as I welcome all of my guests onto my show is to raise our vibration and really get into the flow. I like to start the show by asking all my guests if they've had any golden moments lately. Golden meaning a time you were just totally in the flow, or an interaction you knew was sent by spirit or otherworldly, if the case may be. Something that made you smile or your heart sing. Had any golden moments lately, Og?
Very, very golden. On Christmas morning, we have 4 kids, and it's really special to have them all come into one big room with everybody happy and excited. Santa Claus came, and just that's what a lot of those holidays are about, is seeing kids and other people in your family happy. So that was quite golden.
Absolutely. We were just talking the other day about how in your chiropractic clinic, you see mostly adults, but you do see the occasional child patient every now and then. And you were saying that you really wanted to get into seeing more kids, because the sooner you can get into alignment when you're young and have great posture when you're young, the better off you are down the line. Yeah. Maybe we'll talk more about that later in the episode.
Yeah, absolutely.
So I want to get started by understanding what exactly chiropractic care is. So could you just give us a brief synopsis of what chiropractic care is for anybody who may not be familiar with it?
Yeah, well, let me break it down a little bit and let you guys. I'm going to read some definitions here that come from the American Chiropractic Association and the founding college, Palmer Chiropractic, what their basic philosophy statement is and their mission and the practice paradigm of what chiropractic is, what it's for, and like who it's meant for. We're probably going to discuss later in the show, I believe. But here's a quick definition. Chiropractic is a science, art, and philosophy. The philosophy of chiropractic is built upon the construction of vitalism, holism, conservatism, naturalism, and rationalism. It provides context to the application of the science and art. I'm going to go down a little bit further so you understand. The philosophy in chiropractic is about the basic principle of innate intelligence. And that's what chiropractic is set upon, is to open up the channels for your innate, which is the science part, which is the DNA, the molecules and atoms that make up your body, the nerve flow structure, the blood, and how everything's supposed to happen. The innate intelligence of your body is what chiropractic strives to enable so your body can heal itself. So that being said, chiropractic is there to relieve the interference that nature puts on it. So that, going in a little bit deeper, you've got the science, art, philosophy. The philosophy is how we fix the body from outside to help the innate wake up and take care of itself. The science is understanding the nerve flow, the basic anatomy, the physiology, the muscle, skeletal, and integral components. And then the art is how we practice and how we do it with our hands. Chiropractic literally means to fix with your hands. We've come a long way in chiropractic. There's a lot of tools and techniques that we use now. And expanding on that, we're a non-surgical, drug-free type of healthcare.
Mm-hmm.
So I'm going to come back a little bit, and the main thing we take care of and see, besides all that science part there and the innate and how we do it, is the musculoskeletal system, and mainly to do with the neurologic interface of your spine and how that is the root of all that goes on in your body. Every single part of your body has to communicate with the brain and the spine to work, right?
Mm-hmm.
So we like to just tell people basically, if you're in one big computer system and you've got a glitch in the system and it's not getting back to the computer, you're not going to get the right signal. You're tuning a TV and the signal's not right.
Mm-hmm.
You've got all kinds of analogies like that, but the bottom line is, without the proper conductive signal from the nervous system,
Mm-hmm.
you're not going to get the right message to the end products, which is a joint, a muscle, an organ. So that's what we do. We work on the nervous system by way
Mm-hmm.
of removing a thing called a subluxation, which is a malposition in your spinal cord by way of each vertebrae. So, we can go, and I could probably talk about this for like 4 or 5 hours, but our basic job is to help remove subluxations so your nervous system can be wide open, operating at its maximum, allowing your innate intelligence to function at its maximum. And in that way, we create health and wellness, and that's how we stay out of dis-ease. We stay away from the disease process, and we stay healthy and well.
Mm-hmm.
Long definition, long talk.
No, that's great. So chiropractic care used to be a little bit less mainstream, but now insurance companies are covering it, and it's not woo-woo, it's not taboo. 50 years ago, it was kind of the new thing, but I teach history, and back in World War I, we sent all of our doctors off to war to fight for the U.S. And a lot of alternative medicines emerged back in the early 1900s because all of our traditional doctors were overseas, and so medical schools were having to kind of open their doors, and the people left at home needed medical care, and so practices like chiropractic and correct me if I'm wrong, not MDs, but yeah, MDs, not MDs, DOs, doctors of osteopathic medicine, that practice grew. So in the modern times, now that chiropractic is pretty firmly in the mainstream, and we'll talk a little bit more about how you talk about bringing the body back into alignment. In the metaphysical world, we talk a lot about chakras and aligning the chakras to kind of bring your spirit into alignment. We will talk about that. But why do some individuals choose chiropractic care over Western medicine real quick before we take a break?
Here's the thing. There's so many ways to look at it as far as why would I choose something that's less invasive, drug and opioid free, and I guess more interactive with your healthcare provider, where you have a much more open conversation dialogue. Those are some of the barriers some people don't want to get through, because they think that, hey, there's got to be a quick fix out there. I'll see the surgeon. He's got the answer for me. We'll get it fixed. Or, hey, we've got the family practitioner, who oftentimes are wonderful referral sources to chiropractors, because they don't want to prescribe medication. But some people think, hey, I could just take a pain pill and the pain will be gone, and it's fixed.
Yeah, that's just a masking.
Masking issues. Those are some barriers to care. Or you also have to look at people's, hey, this is going to cost me a lot of money to get well, or do I really want to find out the root of my problem? It's the reason people come to chiropractic is because they want to know the root of their problem. They want to get better without drugs and surgery, and they want to be healthy throughout the rest of their life. Those are the integral parts of why I see people from 2 days old to 93-year-old coming in my door. They're either sick of it, or their parents want them to be on the path of wellness.
That sounds like a good answer to me. We've got to take a break. When we come back, we'll talk about how chiropractic care is a responsive healing treatment or preventative health measure. You're listening to Golden Otter Radio with Autumn Seibel. Taking a quick break. When we come back, more about chiropractic care with Dr. August Manelick. Stay tuned.
Today, the light of quantum consciousness and much more with my very special friend, Mark Anthony. Mark, it's great to have you.
Thank you, Dr. Pat. I always enjoy working with you, and I think Transformation Radio Network is absolutely the most enlightened voice on the airwaves.
Wow, thank you.
We are back on Golden Otter Radio with me, Autumn Seibel. My guest today is Doctor of Chiropractic Medicine, Dr. August Manelick, who's talking with us about the difference between chiropractic care and traditional Western medicine. But before we continue, I want to make sure that everyone knows how to contact him or get additional resources on chiropractic care. So Dr. Manelick, could you give us your contact info for listeners?
Yes, absolutely. We are located on the web at altitudechiropractic.ak.com. You can also find us on Facebook at the same Altitude Chiropractic LLC or Altitude Chiropractic in Alaska. There is one other Altitude, and they're in Denver, but I didn't know that when we first started the business anyway.
So shout out to Denver.
Little shout out to the Denver. So that's basically it. You can call our office, 907-745-5444. And, anytime you want, you could just Google us in Alaska, Altitude Chiropractic AK.
And you have resources.
And we'll come up on your Google map.
And you have resources on your website?
Yeah, absolutely. We've got plenty of chiropractic links where you can go in and find plenty of information about chiropractic. There's free consultations for anyone who just wants to come in and talk about a possible treatment plan. Most every chiropractic office should offer a free consultation for you to come in and meet the doctor, talk about the problem you have, see if she can fix it, or diagnose it. And I mean, that's just common practice in our field.
Thank you. That's a good jumping off point. So before we went to break, we were talking about chiropractic care. Is it a responsive healing treatment or a preventative health measure? And you're saying both. Essentially, we're saying if, and this is the training that I had when I did my health coaching training, is that when given half a chance, the body can and will heal itself. So you were saying that chiropractic care is preventative and responsive. So you can get in alignment before you have a problem and come in when something is presenting.
Oh yeah, absolutely. So people all the time, they want to come in generally when there's a sign or symptom that's driving them, and we've been called the Obi-Wan Kenobis of the healthcare industry. People show up and they will say, I have been everywhere and done everything, and I'm here now. Please help me. You're my last hope. And I say, well, holy smokes, there's a whole big paradigm here where there's been a long process of potential degeneration from years of overuse injuries or an acute onset lifting problem that accumulated scar tissue around it. I mean, there's so many different levels of the pain scale and injury spectrum of the degenerative processes in the spine. Where we'd like to see people is early and often to prevent that. Oftentimes that's when someone doesn't even have symptoms. And then also we can help with that acute injury before you get that scar tissue laid down improperly, to augment the healing process. That's really pivotal, especially in acute injuries in football, automobile, fall accidents, something where there's an acute onset. It's really important to get in there very early and often to kind of fix it. But yeah, I mean, you can come in for wellness. I've got plenty of patients that say, man, I finally feel great. I really want to keep this up. And I say, well, let's keep you on a wellness basis. And those kind of patients, you can be anywhere from every month, every other month, quarterly, biannually, or annually. Just depends on how active and how well you take care of yourself. I mean, the big deal in life and how, do you want me to step off for a second, or do you have another question? I can finish this one really quick.
Yeah, finish.
One of the biggest things that influences the need for chiropractic care is the pillars that we call the subluxation makers. So you've got your thoughts, which can be anything psychophysical, psycho-emotional, physical thoughts, and then we've got the trauma, which could be the actual effect of something, skeletal, muscle, not just the stress on the body's organs and tissues, but the actual physical portions of stress. And then you've got the last one, thoughts, traumas, toxins. You've got the atmosphere, you've got the world around us, you've got pesticides, chemicals, unhealthy diet, any type of thing that is in your body that's from the external and put in is a toxin potentially. And all those things cause our body to come out of alignment, and that affects our overall health, right? So that's what we like to tell people. Let's fix all those things, or let's try our best to get a real good handle on our thoughts, traumas, and toxins, and leave the manipulation of the chiropractor just to get you in alignment.
I like that. Thank you. So I want to talk about how you chose to become a chiropractor. Obviously, since you're my older brother, I know your backstory, and we grew up super active kids. We all played contact sports. You played football, hockey, wrestling. I played soccer, volleyball, and then we both played college, and our other brother did too. At the university level. Thankfully, I didn't have a ton of injuries. You guys did, but you were able to get through a lot of them through physical therapy and chiropractic care. But after you went into the military, what made you decide chiropractic medicine was what you wanted to do?
This is a question I get asked periodically by patients. Patients' parents, they always go, well, if it's a younger kid or college kid, they say, how did you get into chiropractic? What brought you over to this side of the aisle? And I tell them, that a lot of it has to do with the fact that I was trying to transition out of the military with a family. And I think that was just kind of, I was getting away from that path of being gone and in that type of hostile environment. But the other half was the fact that I like to work with my hands. I like to help people. And my undergraduate was in physical therapy initially. And I had kind of gotten a really good taste of that. And I thought, man, I want to do a little bit more, but I didn't quite want to be a surgeon. So I thought to myself, how do I just get to that happy place? And it was a really good deal because I was applying to schools after getting out of the military, and it was either I could go to PA school to be a physician's assistant, which I had thought was a really great option for me, possibly transition into that, maybe, do some home care, maybe get into the surgical realm that way. Or I had thought about chiropractic because going through sports and in college and in the Army, I had some really significant injuries to my neck and low back. I had them bad enough where I had multiple disc herniations where I had 60% motor decrease in my upper extremities along my C6 dermatome, which if you wanted, like, just pull your hands up and make little toy guns in your hands where your thumbs are out and your fingers are pointing like that, that right there is your C6 derma, and then myotome up through your bicep and into your shoulder. So what was happening is I was trying to work out and be strong and, athletic and part of the fighting force. And I was experiencing severe muscle loss. And I'm telling people, hey, I have muscle loss. And they say, well, you're a strong guy. What's muscle loss? And I'm like, I can't quite do this. And we got tested and they're like, you need a nerve conductivity. They found out, I took x-rays, did an MRI, and they're like, you got severe herniations in your neck. We should probably think about not either getting out of the military and no more rugby or surgical intervention or something, but it's got to be fixed. So I turned to chiropractic, and I'm not saying it healed me, but it saved my life from being immobile, unable to be athletic, unable to be in the military, unable to play sports, pick my kids up. It kept me from fused neck, permanent nerve damage. It turned my life around. So I thought that's the kind of thing I could do and be open to. And, the more I got into it, the more I got involved in the recruiting process and talking to more chiropractors, and, it had been adjusted and it fixed me, but talking to people about it as a profession is what sold me on it. So that's how I decided, you know what, I'm going to do it. I'm going to go to the chiropractic school and I'm going to be a chiropractor.
I remember when your oldest daughter was young and you were making that decision for your family, and we were supporting you as a family, and you said, guys, I want to be able to lift my kids up over my shoulders, and I can't do that. And that was kind of the entryway. And, so speaking of, you're a veteran, I wanted to talk about how chiropractic care could be used to fight the pain medication epidemic that's plaguing our country for veterans who are coming back injured and just in general. Do you see, I know that the armed forces is starting to incorporate chiropractic care, but do you see an avenue for that ballooning? And maybe if more veterans knew about their resources, and instead of first line being an opioid or a narcotic, maybe saying, hey, hand raised, I'd like some chiropractic care. What would you say to those guys who maybe don't know much about chiropractic care, but are in the same boat that you're in, or you were in after coming back from Iraq?
Right. Well, what I want them to know, first of all, is that the American College of Physicians, and this is a big journal and guideline setter, updated their guidelines in 2017 that stated that treatment of acute and chronic low back pain chiropractic care was recommended first as a non-invasive drug-free treatment of restorative health and therapy before they would go on to the next level. This was the guideline set out in 2017 that they said, we would like to see people initiate in chiropractic and therapeutic means, non-drug, non-surgical intervention wherever possible to combat this opioid addiction from starting in those people just coming into the system. Now, those that are already in the system, there's a weaning off process where we've got to tighter down their opioid use and transition them into something that's going to help make them better. One thing people don't know, and this is very important about opioids, once you get it on an opioid to take care of the pain, what we're also doing is you're turning off your own body's internal capability to recognize those pain receptors. So you need to keep increasing the pain medication dose to feel the same effect. That also at the same time disallows the body to hear, see, and feel those neurologic impulses. So you actually become weakened in a way to your own pain levels. So a person, for example, who was feeling like a 5 to initiate, a 5 out of 10, and a 0 is no pain, a 10 is, I tell people, I'm like, if you got a 10, you need to be in the hospital. So shoot me straight. Tell me how you are for real. Like everybody's got their own pain tolerance. And if you start off at a 5 and you're on opioids for a month and you come back in and you're off for a little bit, a lot of those people will come back in and they what were a 5, they're worse. They're a 7.
Yeah.
Because they're not doing the therapies. They're not feeling the pain that they should. So they're just using more medication to compound the issue. I didn't answer your question fully, but I can in a minute.
You do. We're going to take a break. And when we get back, we'll talk more about active duty or prior service members or people with labor intensive occupations or anybody who's been injured can be best served by chiropractic care. So hold that thought. We'll be right back. You're listening to Golden Otter Radio. We're back on Golden Otter Radio with me, Autumn, and my amazing guest today, Dr. August Manelick, who's here discussing how Eastern medicine is making its way into the mainstream Western world via chiropractic care. So before we went to break, we were talking about the opioid epidemic that is plaguing the United States right now, and how veterans or active duty service members or anybody who is in a labor intensive job or has had any kind of physical trauma can seek chiropractic care to manage their pain. So Augie, before we went to break, I was going to say that I was just up at Walter Reed the other day doing research, and not on Golden Otter stuff, actually on World War I history was what I was up there for, which is when Walter Reed was established, Walter Reed Medical Facility for any history buffs out there during the World War I era. And they were actually doing Reiki in the center, the grand foyer, which I don't know if you're familiar with Reiki, but it's essentially a type of hands-on healing where a healer will move energy through their body and put their hands on a person. And sometimes it's a light touch, and sometimes it's just the hands above the person's body. And they are drawing in light source energy down into the person's body to to give them healing. For any Reiki masters out there, I apologize if I've completely oversimplified that. Reiki is not my strong suit. I'm a big believer in it, and I've experienced Reiki healing, but I don't actively practice it. But that's essentially the idea. And, some people might argue it's a placebo effect, and some might say it's true, genuine healing. But at the end of the day, if it's getting somebody off of opioids and all the detrimental effects that they have on an individual, their families, and communities at large, then does it really matter? And isn't it just a matter of semantics? So talking about the more energetic realms of physical care, of hands-on healing, how can a patient create a positive, energetic relationship with their care provider? So at the top of the show, you said that when a person comes to you, it's generally more of a conversation and they have to take a more active role in their healthcare. Whereas if they just go to a surgeon or if they go somewhere else, they say, this is the problem, you fix it. How can somebody who maybe is used to a different model of healing become a partner with their provider?
So what I'm thinking is how to jumpstart into chiropractic. If you've never been, you don't know what to expect. You've got pain somewhere, but you don't know exactly what's causing it. You don't know what to do. Really, there's so many avenues to search for the right type of provider for you. Now, I have got patients that do brain mapping therapy, occupational therapy, physical therapy, regular. There's some that come from only massage therapy clinics. There's all kinds of other people in the wellness world that aren't just focused on medication. So you've really got to decide how you want to approach it. If you want to approach it through wellness, find a chiropractor locally, find somebody that like and trust, that's reputable, that's been to an established university, accredited through their state national board. Sometimes it's as far as going through and looking up the references online. There's a lot of people who have really great and really not so great outcomes. You want to see how their outcomes are. Kind of like when you're trying to find, like in my field, I try and find and match people with, if they have a shoulder issue that I'm not able to help them with muscle balancing therapy and therapeutic massage, myofascial tissue release, adjusting. I try and get them in with the best shoulder doctor I can find or know. And a lot of times that comes down to patient outcomes. So you want to find people, and by patient outcomes, I mean positive or negative, where they are either functioning much better, kind of at the same, or not as good as they were before their surgical intervention. So I try and think of it the same way in chiropractic, because I'm originally from the mindset of traditional medical, thought process. So I like to tell people, I've been on both sides of the aisle, and I want to treat you the best I can, and I want to be realistic about your care. Overall, number one way to find a chiropractor in your area: Google them, review them, see how they treat people, see how their front desk is, their front area, how anyone would treat you, and
how you feel.
I tell everybody, how you feel there. And in a chiropractic setting, which often placed when chiropractic first started, it took place at people's homes. It's supposed to be a fun, holistic family environment, and that's what I strive to create here with my clinic and my staff and my therapists and my office manager. Right now, everything. You're supposed to come into a place, feel welcome, happy, so you can turn on positive energy. Because like you were mentioning Reiki, so chiropractic was expounded upon through, it's called mesmerism, where you would feel magnetic energy. And a lot of times, I've got other providers that believe in that too, where they'll say, we need to take a 2-hour break in the middle of the day. I've given too much of my magnetic energy to too many people. It's hurting me at the end of the day. So I got to back off. That happens all the time.
That's the same in like mediumship and doing readings. When you overextend your energy into somebody else and you're not filling up for yourself. I just talked about this on 2 shows ago about the wounded healer, and you're giving so much care to another person that you don't pause to fill up your cup. Yeah, so I was going to actually ask you that when you are adjusting patients, what other kind of information do you gather by doing hands-on healing? Like if somebody presents with something and says, and do not violate HIPAA, obviously you would never would, but if somebody comes in presenting one thing, how often do you find that their presenting symptom is not actually the root cause? Like how many layers do you go down? Because I'm of the belief that anytime somebody seeks any kind of healing, they're coming and saying, I have a problem and I need somebody to help me with this. And maybe
Sure.
they don't even know what that root problem is, but it's an uncovering. And, we, for the listeners who maybe didn't listen, I had my very first episode on Golden Otter was with my mother, who is our mother, who is a internal physician, an internal medicine doctor. And we watched her in her practice for the last 30 years with thousands and thousands and thousands of patients. And she's internal medicine, but she would run the gauntlet of care. And I think you and I both witnessed that people would come in with pain and say, here's my presenting pain, but there's a deeper pain here, or there's a deeper problem. And can you help me get to the root of that? How often would you say that's the case in chiropractic care? Or is that always the case?
Sure. Well, here's how we'll kind of break it down. This is how we identify it, and this is how you bring it in. So when somebody first comes in, you do the initial consultation.
Mm-hmm.
What they do before you even start talking to them, they fill out their history, family history, a review of symptoms, which means, review of systems, and then their overall subjective, what hurts or what's the problem, complaint. We've got 9 out of 10 times somebody's not going to come in because their stomach hurts to a chiropractor. They're going to come in because their low back hurts, but that could be a manifestation. Let's say, 19-year-old girl, polycystic ovarian disease. She comes in, she doesn't know. Her back's been hurting since she was 15. Nobody knows. We can't find out. We've been to the OBs, this, that, the other. Chiropractor says, hey, let's give it 2 weeks. Clinical indication says, let's look at this. Let's try, because your back is out of alignment. We'll figure that out. But along the way, within the 2 weeks, if you're not fixing something, you got to dig even deeper. Mm-hmm. So, all that stuff necessarily doesn't get caught on the first visit, but a lot of things through consultation, exam, and presentation, you're going to find something on somebody that's not necessarily going to pop out in everyday conversation. So we do find a lot of stuff that gets missed by their medical doctors, or they've been sent to us by a provider or physical therapist or their OB, and somebody says, hey, they've got low back pain. We don't know what to do. Or, hey, they've got neck pain. See what you can find. Maybe there's a out of alignment bone or a pinched nerve, herniated disc. Chiropractors have so many tools. We've got some of the best radiographic imaging, there is in the world, with hospitals near us, with our own clinics having x-rays. So really, more often than not, we're going to fix a musculoskeletal issue. Mm-hmm. But you do come in, you do find abuse cases, you do find, the abuse or family issue problem. You've got kids maybe getting bullied at school and they say their knee hurts, they don't want to do gym class. Well, why not? Well, and then you get the problem with that with the parent in the room. And, it's just about being relatable to people so they can give you more information than what you're asking. At the end of each interview. At the end of each interview, I tell them, I'm like, I tell them 3 things. I say, first of all, it's like, I let them know this isn't a miracle cure. If I'm not helping you in some way after 2 weeks, I need to do something more to get you there. Mm-hmm. Either refer you out, change the way we're doing it, get some advanced studies, blood work, or get you in to see somebody else. The second thing I tell them is, it's not a miracle. We'll do the best we can. The third thing is there anything else that you want to tell me that you haven't already told me about, especially about your family, how you feel, anything you want to tell me about, because I already asked them the questions. Surgeries, car accident, illness, I go down this giant list with them, and they fill it out either online or in electronic database. So they're not getting asked the questions. They can fill it out how they want to. And then when they come in here with me, I have a chance to rematriculate what they tell me into their history. And then that's basically how you do it. So you don't miss red flags and you don't hurt people. You make them better.
So in the metaphysical world, a lot of talk about body work is that our body and our tissues actually store and hold memories. And through chiropractic care or massage or body work, energetic body work, you can kind of clear your tissues of trauma, whether it be physical, emotional, or spiritual, and you can kind of clear that from your system. And it sounds like to me what chiropractic care really is just old school medical practices where you are holding space for your patient to get to the root of the issue that they're presenting with to heal. They're bringing you their pain and saying, hey, help me heal. But we are going to take a quick break. When we get back, we will talk more about Dr. Manelick's pro tips for activating deep energetic healing in your life. Stay tuned. We're back on Golden Otter Radio with me, Autumn Seibel, and I have Doctor of Chiropractic Care, August Manelick, here discussing the bridge between the metaphysical and the mainstream. Now he's going to give us his pro tips on activating healing in your life. But before we do that, Dr. Manelick, could you tell us where our listeners could find you again?
Oh yeah, you can find us on the web. You can Google us. You can find us on Facebook, altitudechiropractic.ak.com. There's a limited number of followers on our Instagram. My social media marketing producer, Austin Manelick, really tried to push us into the now with Instagram. So you can follow us on Instagram. I'm on there as Altitude August. So check us out on the gram and on the book and on the Google.
Altitude August. None of us are big social media users, but well, you and I aren't, but we are slowly joining the tribe. So you can also find me on there on Golden Otter Divinations on Instagram. I'm on Facebook as well if you're looking for me. So right before we went to break, or actually while we were at break, one of your massage therapists came in and we were just saying hello really quick. And we were talking about hands-on healing. And I said, have you had any experiences when you have hands-on healing? And she said something really interesting. She said that when she does massage therapy, and I've heard this in the metaphysical realms, when you do healing, she doesn't use her energy. She says that she opens the space up for the energy to move around and through it, but not necessarily through her. So she's not running her own energy, which maybe we'll be able to get a clip of that on there. But would you say that that is a similar experience that you have doing chiropractic care?
Oh man, absolutely. I like to give people a lot of opportunities to opt out. Okay. I really want them to be totally sold on the fact that, not just sold, but invested in their health. This isn't something I want for them necessarily. I do because they came to me and I want to help them.
Mhm.
This has to be something that they want.
Yeah.
They've got to come here. They've got to start this journey, and they need to think, I need to really look at myself. I need to look at my life, and I need to think, where do I want to be X amount of years? What is the, I guess, pitching point or the turning point of my life where I want to be better than I was yesterday, and I want to fix this. That's what I try and get in people, and I want them to have a lot of opportunities to say, maybe this isn't for me, and that's fine. That's one of the biggest things for me is investment in yourself, finding something that you want to get better for. And those are the two real big turn-on factors for getting somebody from, unhealthy lifestyle, poor choices, bad sleeping, no exercise, bad relationships, you name it, all these things, it boils down to how bad do you want to be in a better place. So
You have to have a big enough why.
Yep, it's the why.
I've heard, Tony Robbins talks a lot about what's your pain or your pleasure lever. So your pain has to be significant enough, or the pleasure or the reward has to be large enough that you're willing to do whatever it takes. And you know what? I would completely concur. I did my health coaching training, and that was one of the biggest things that we learned is that like the reason that coaching is successful isn't necessarily because of the coach. Oftentimes it's not at all due to the coach. They're just holding space. It's just holding the space for somebody who wants to make a change to come in and make that change. And like we talked about a little bit ago, watching our mother be an internal medicine doctor for the last 30 years and seeing thousands of patients, it really does come down to how bad does somebody want that healing for themselves and what is their reason why.
Yeah, absolutely.
Ultimately. Yeah. Well, and I really like that. The tips for undertaking an exploration of body work and hands-on healing. Chiropractic care, for anybody who's listening, is a great mainstream way to kind of get into the more alternative hands-on healings. There's a lot of deep release techniques that people do, a lot of energetic work. So for me, I think that chiropractic care is a really great first step into that kind of alternative world because it's very, much steeped in medicine, and you have to be licensed and, to be a provider. Yep. All right. Well, that's it. It's time to go. So thank you so much for listening. Be sure to follow Golden Otter Divinations on Instagram, where you can check in and let me know about your golden moments so Spirit and I can cheer you on. Also, if you'd like to contact me or join my monthly manifestation membership, Lunar Manifestations, visit my website, goldenotter.us. That's golden like the precious metal and otter like the precious animal. Please take a moment to sign up for my bi-weekly emails and get up-to-date information on all things Golden Otter. I want to thank my guest today, Doctor August Manelick, for sharing a wealth of energetic healing and knowledge. And I want to thank you all for tuning into Golden Otter Radio. I had an amazing time sharing this sacred co-creation space with you. Please join me every first Friday at 9 a.m. Pacific, noon Eastern. Our next show will be Friday, February 1st, with author Dina Miriam discussing her new book, Exploring Past Lives, entitled My Journey Through Time, a spiritual memoir of life, death, and rebirth. Thank you so much for joining us, Dr. Manelick. Look at that.
Thanks for having us. It was fantastic.
All right, everybody.
Like us on Facebook.
Have a great week, and I'll feel your positive vibes back here next time.
Thank you for listening to Golden Otter Divinations, where the metaphysical meets the mainstream with Autumn Seibel. Tune in the first Friday of every month at 9 a.m. Pacific on TransformationTalkRadio.com. Exploring where the metaphysical meets the mainstream, Golden Otter Divinations helps you draw in the abundance that is yours by divine right. For more information or to listen to this show, visit goldenotter.us. That's golden like the precious metal and otter like the precious animal.us.